Urine bile test can be tested through which test? A. Hayes test. B. Benedict test. C. Fellings test. D. Cole test. And the correct answer is A. Hayes test. Hayes test is used to detect urine bile presence. Benedict and Fellings test is used to detect urine sugar, and cold test and hot test are used to detect urine albumin. Hot applications cause all the following except A. Peripheral vasodilation, B. Increased capillary permeability, C. Increased oxygen consumption, D. Decreased motility of leukocytes. And the correct answer is D. Decreased motility of leukocytes. Hot application cause peripheral vasodilation, increased capillary permeability, increased oxygen consumption, increased metabolism, decreased blood viscosity, decreased muscle tone, increased blood flow, increased lymph flow, and motility of leukocytes. Isotonic saline contain how much amount of sodium chloride? A. 0.9 mg per dl, B. 9 mg per dl, C. 4.5 mg per dl, D. 5 mg per dl. And the correct answer is A. 0.9 mg per dl. Universal recipient of blood group is A. O group, B. AB group, C. A group, D. B group. And the correct answer is B. AB group. Person having blood group AB have A and B antigens on the surface of their RBCs, and their blood plasma does not contain any antibodies against A or B antigens. Therefore, AB blood group can receive blood from any group but can't donate blood to any group other than AB group. International Day for Nurses is celebrated on A. December 1st, B. May 12th, C. June 2nd, D. May 1st. And the correct answer is B. May 12th. International Nurses Day is celebrated on May 12th, which is the birthday of Florence Nightingale. Which of the following equipment is most essential to prevent risk of cardiac arrhythmias in a patient receiving multiple transfusion of blood? A. ECG machine, B. Cardiac monitor, C. Blood warmer, D. Syringe pump. And the correct answer is C. Blood warmer. Rapid transfusion of cold blood places a patient at risk of cardiac arrhythmias. Blood warmer is needed to rewarm the cold blood to the body temperature before transfusion. If a narrow cuff is used for measuring BP, then what will the outcome? A. Actual reading will be obtained. B. Falsely high reading will be obtained. C. Falsely low reading will be obtained. B. BP can't be measured. And the correct answer is B. Falsely high reading will be obtained. Use of narrow BP cuff leads to falsely high reading, and use of large BP cuff leads to falsely low reading. Presence of fresh blood in the stool is known as A. Hematochezia, B. Melena, C. Hemoptysis, D. Hematuria. And the correct answer is A. Hematochezia. Doctor ordered oral as well as nasal suction to client. You will do suction first in A. Mouth, B. Nose, C. Where the secretion is more, D. Where the secretion is less. And the correct answer is A. Mouth. Always do first suction in the mouth, then the nose, because doing suction first in the nose will stimulate pharynx and cause aspiration from oral secretions. During the examination of ear of a 2-year-old child, the pinna needs to be pulled in which direction? A. Upwards and backwards. B. Downwards and backwards. C. Straightly backwards. D. Pull it downwards. And the correct answer is B. Downwards and backwards. For examination of ear, straighten the patient's ear canal by pull the pinna downwards and backwards in children less than 3 years. Pull upwards and backward in aged 3 years and above. Gradual increase in rate and depth of respiratory is known as A. Hyperventilation. B. Hypoventilation. C. Cosmal respiration. D. Kinestokes. And the correct answer is C. Cosmal respiration. Cosmal respiration is type of hyperventilation, that is the lungs emergency response to metabolic acidosis. The carbon dioxide need to be eliminated from the body, so the rate and depth of respiration will be increases. Which site is used to assess the status of circulation to lower arms and auscultate blood pressure? A. Apical. B. Temporal. C. Axillary. D. Brachial. And the correct answer is D. Brachial. Circulation to lower arms and blood pressure is measured in brachial artery. All of the following are signs of cardiopulmonary arrest except A. Constricted pupil. B. Immediate loss of consciousness. C. Dilated pupil. D. Absence of pulse. And the correct answer is A. Constricted pupil. Constricted pupil is not a sign of cardiopulmonary arrest. It is seen in opioid poisoning. In which of the following condition the oxygen therapy not indicated? A. Drowning. B. Chest injury. C. Poisoning. D. Normal uncomplicated labor. And the correct answer is D. Normal uncomplicated labor. In normal uncomplicated labor, the oxygen therapy is not indicated.